Hey everyone, and welcome to the Nursing Insights podcast. I'm Sue Weaver, and along with Daria Wazak, we're excited to be your new host for the New Jersey Collaborating Center for Nursing's Nursing Insights podcast. Let's be honest, healthcare is in a tough place right now. The nursing shortage certainly doesn't spark joy, as they say. We could dwell on the challenges, but nurses are problem solvers, and change is happening. That's what this podcast is all about. Join us as we talk with nurses and healthcare professionals across New Jersey about their experiences, challenges, and triumphs, and how they're helping to shape the future of nursing. For this episode, we have something special for you. We're coming to you from a committee room at the New Jersey Statehouse in Trenton, where we'll be speaking with 3 distinguished panelists about political advocacy and state-level testimony. If you want to watch this as a video, you can find this on YouTube. So our guests today are Dr. Marcel Kavanagskaya, APN and President of the Society of Psychiatric APNs, and Assistant Professor at Felician University School of Nursing. Tyla Maneri, Chief Operating Officer of the New Jersey Healthcare Quality Institute, and Rose Catton, Executive Director of the New Jersey State School Nurses Association. We are so thrilled to have them here to share their insights and experiences. So I want to start maybe with Marcel, and the other panelists can follow. Tell us about what happened in your career that inspired you to get involved with state policy advocacy.
Check if this is on.
Now it's on.
It's on. Okay. Hi, everyone. Good morning. It's a great question. So I grew up in New York. I practiced in New York. I work for the VA. The VA is full practice authority in all 50 states, including Guam. And when I came from New York to New Jersey, crossing the bridge, I lived in Bergen County, and I'm like, what is going on in New Jersey? Like, why is full practice not happening? What are the issues? There's so many barriers to access to care. I started practicing in psychiatry here, and nobody's seeing kids. Nobody wants to, take on kids. A lot of nurse practitioners are not really being trained with this quote unquote collaborator that we have. And I really was advocating a lot when the Nurse Practitioner Association of New York was trying to pass full practice. So coming to New Jersey and seeing that wake-up call, I was like, I have to do something. I have to get involved. I got involved in the Society of Psychiatric Advanced Practice Nurses as a tongue twister, SPAPN. And we really kind of restructured the whole organization in a way to kind of be in line with what a typical organization should be. Because when I was there, just as a member, now I'm the acting president. There was a lot of things that were like kind of falling apart financially. There was a whole restructure that needed to happen. And, it's really important to kind of take all of the aspects of what is a successful organization, what is the voice and meaning of that, and apply it. So to summarize the answer to your question, it was really coming from another state and just having a huge wake-up call and realizing that what we're doing in New Jersey for patients, we want to do the right thing, but there's a lot of what I love to call bureaucratic paralysis, when my mentors call that. And I think that's what we have here in New Jersey, is a lot of bureaucratic paralysis to do the right thing for our patients.
Well, thank you for your advocacy. And for those in the audience, if you want to watch some videos of Marcel advocate for full practice authority, just Google on YouTube. But he makes a very strong case. So Kybal, tell us about your experience. What made you get involved with advocacy?
Yeah, thank you. I started my career as an advocate. So I graduated from Rutgers University, political science. So I went straight into campaigns. So I started out just looking for different campaigns across the state, eventually made my way here to the governor's office, and then found my way to being chief of staff to Assemblyman Troy Singleton. If folks are familiar, he's now a state senator down in Arlington County. And really there as chief of staff, you heard Jean talk about it a little bit earlier. Staff for the legislators are the people who do all of the work, right? The people who do the research, the people who talk to constituents, the people who come up with policy ideas with their policymaker. So as chief of staff, I really found myself looking at all kinds of issues, from women's health to labor law to all different kinds of things. And from there, I really wanted to be an expert in something. I was kind of an expert in all things, and it was a little too much. So I really wanted to dial in my expertise, and healthcare made the most sense to me. It was something I felt passionate about, something I knew had longevity, and in particular, workforce issues and providers. So from there, I went to the Hospital Association and started doing actual lobbying work, which G talked about earlier. So there I was actually directly lobbying the legislature on behalf of the hospitals across the state. So really kind of got a crash course in how to be a lobbyist, how to advocate on behalf of an industry, and spent a couple of years there doing that, and then found my way to the Body Institute, where I've been for the last 10 years. So there I advocate on behalf of our members, but really on behalf of the healthcare industry as a whole. We're really thinking about how to make healthcare quality, high quality, affordable, and safe. So really it's healthcare for everyone. So that includes nurses, physicians, health insurers, hospitals, et cetera, et cetera. So kind of came full circle from my campaign days and being an advocate on the ground to really thinking about policy and how it affects everyone in New Jersey in terms of their profession, in terms of how people are cared for. And obviously it's there's no shortage of work that needs to be done in healthcare. So I find myself always having something new to work on, always having something new to strive for in healthcare. So I know we're going to talk about a lot of that, but I've been an advocate my whole career, essentially, for healthcare.
Wow, thanks for telling us about your career journey. That sounds exciting. And Rose, tell us about what made you get involved with advocacy?
First of all, thank you. I'm so honored to be here. I'm honored to sit here amongst these panelists. So as Tyler came to this early in her career, I came to all this very late in my career. So I was a practicing nurse, and as you know, according to my bio in peds, and I did clinical research, always pediatric. So I worked at CHOP, I worked for Pfizer doing clinical research, and then I became a school nurse. And I just loved every one of those practice settings. And in each of those positions, I just found myself, I had always had a lot of energy and enthusiasm. So if someone, if there was some cause, just something going on in the landscape to kind of influence, I was always willing to just step up and help. And I was really a helper. I really wasn't someone who really led the charge, but I was a big supporter. I was willing to do the background, do the research, go to the meetings, partner with people. And I think that was my strength, was that I'm kind of a collaborator. And in my school nursing position, I became very connected in the community, like with the politicians, with the different, municipal agencies like the police department. And I became very involved in the county, and I was on the Medical Reserve Corps. And I guess people started to see me as someone who showed up. I really think that's what it was. I wasn't doing anything, fabulous, but I was like reliable, and I was there. So I was asked for my opinion many times, and I was interviewed for like the newspapers, would interview me. And also I come from a background where I'm a big believer in joining professional associations. So, I'm a member of Sigma Theta Tau. I'm a member of this, local school nurse association, the state, the national. And I just felt that in my role as a part of the associations, I just so admired the people who spoke up and advocated for whatever, the issues were. So I guess I was very receptive to doing that when I was approached. And I said yes when I was asked to testify at the state and we'll talk about this later, for the issue I testified about. And it really became the beginning of me doing that again and over again. And I guess I just developed, I'm not an expert, but I'm passionate about what I do. I was motivated, like to get back to the question, I was motivated by what I saw in my little corner of the world. I saw, immunization, rates dropping in the school. I was working, and I saw students dying of, opioid overdoses. I mean, there were so many things, and those were the two passions that I ended up having and really testifying on behalf of. And I was representing different, agencies, the county health department, Bergen County Health Department, the State School Nurses Association, and also the National Association of School Nurses. So, it was really a model of what I saw as far as advocacy that I really always valued and admired. And then I guess what I was seeing in my practice, I kind of combined those to try to make a difference. So that's my story.
Well, thanks. You can tell from what you said, you're very passionate about this. So thank you for that. So now we learned, many of us, myself included, learn by example. So can you give us an example of a bill you testified for, and what did you say from your background to convince others during the testimony, and then also tell us the outcome from your testimony? So who wants to start? I wonder, what about Marcel? Do you start? I wonder what you're going to talk about.
First, I want to say thank you both for what you do. Really, I really, really respect that, and I feel the passion. Can you repeat the last part of what you mentioned for the question? Do you mind?
Tell us about the bill.
The bill and what I testified for?
And anything, what in your background did you bring forward when you testified?
So this is a loaded question.
Yeah.
I'll talk about the full practice authority bill that I testified for. Really, yes. It was 3 panelists. I represented mental health for the nurse practitioner community, and my colleague Amita Avadani represented adult geriatric and family nurse practitioners in the talk. I'm duly certified, so I spoke to that as well. And one of my colleagues, Nick Blanc, spoke to certified registered nurse anesthetists, which are also on our bill. And what I spoke about and what I really advocated for was for mental health access, especially for kids. If you are ever going to be involved in any type of legislation and you really want to get it across, you have to do your homework on each legislator that you're pitching to. It's almost like a business plan. And for me, what I learned and what I kind of spoke was from the heart. I think that reading off of a paper and using factual points was, for example, when I testified for the Medicaid access to kind of remove, budgets in terms of allowing it for the community, everyone had the same thing. Medicare is a lifeline, Medicaid is a lifeline. It was the same kind of, jargon and rhetoric, and you want to sound different. You want to speak from the heart. So one of the things I said was, I rather pay a toll than pay a collaborator. And that really resonated with people, that people are flocking and leaving the states that are competent nurse practitioners. And when you take your nurse practitioner license, you also take your nursing license. And we already have a shortage of nurses. So I think that spoke a lot to legislators. I advocated on the fact of the high suicide rates, like 10%. And I think it was like 9 or 10% at the time when I testified. Kids were contemplating thoughts of suicide. That's a lot. That's a major statistics. And now the data shows that New Jersey has one of the best mental health, statistics. And I'll talk a little bit more later, but Executive Order 112, I think, has such a huge impact with that, providing access. So I think to summarize your question, I really think it was the passion of what I wanted to convict in terms of mental health access, which is a huge passion of mine. And there's a lot of kids out there that I see that have Medicaid and nobody wants to see them since New Jersey went to managed networks. It's a problem. Access to care is a huge problem. And, it's across the board, not just kids, but I'm just specifically honing in on children because I think our youth are our future here. And I think we really have to advocate for something that you're passionate about. So for me, it was taking that drive and selling it to a legislator. And as you mentioned, speaking to chief of staffs and talking to them and, getting legislators on my table to understand that it's for the better good. It's for the utilitarianistic perspective to pass a full practice authority bill that does not cause any hindrance. The evidence is there. There's tons of research on full practice authority states. And I wanted to, prove that point to legislators. So I really spoke from the heart.
Well, thanks, Marcel. And we know the outcome. The bill is still pending, and we're optimistic. Maybe in lame duck it will pass. Otherwise, it has to be reintroduced because every 2 years in New Jersey, the bills have to be reintroduced. And just as another side note, I consider myself a legislative junkie because I will listen to the testimony. It is recorded and you can go afterwards and listen to it. And it's very exciting. I think during that testimony, I remember Senator Vitale saying, "We get this. We know this." And it passed out of the Senate, but that's where it remains. Yes. At any rate, so tell us about your experience testifying.
Sure. And that's a really good point. I go back and listen to testimony too on certain bills because it really helps. Even if you're in the room here, it can get very loud and crowded and hard to hear people. So definitely go back and check out testimony online. It's much easier to hear and really get people's points across. So I thought I've testified on dozens and dozens of bills over the years. So I thought I would tell you about something controversial because that's more fun and it's branch of bills that I testified on. So when I was working for the Hospital Association many, many years ago, I testified against nurse staff ratios in nursing homes. So that I would consider to be controversial because obviously now we know there are nurse staff ratios in nursing homes. So at the time, I wanted to share this example with you because people, especially from organizations who have contract lobbyists, aren't always testifying for or against a bill to advance or kill the bill. You can also be testifying on a bill because it's an opportunity to talk about something that doesn't get talked about enough. So on that particular bill, we were not against nurse staff ratios in nursing homes. We wanted to testify because there was no resources being put forward to actually recruit, retain, and advance these nurses. So where are we getting the nurses from to actually create the staff ratios? So in that instance, it was an opportunity for us to have a platform, to have a microphone, to actually come forward and say, let's advance, loan redemption. Let's advance other resources where people can actually utilize these careers. And we have a better pipeline of nurses to actually take these jobs and stay in them. So I think that was just a good example of an area where later on in my career, I testified for nurse staff ratios. So just this opportunity and being in front of the legislature, Jean said it earlier, there is a process and there's a respect to be had for what's going on here. It's not always about the outcome. Sometimes it's also about the opportunity and talking about things that just don't get enough attention. But being here in front of a dais full of legislators is a big opportunity. And to hear it afterward online and for other people to hear about the issues that are important that aren't being dealt with. So I just thought I would share that example.
Well, thank you. And what was the response you got when you just shared that?
I was nervous, of course, because it was a controversial opinion, I would say. But I think the legislators that were there respected the fact that, oh, wow, I'm not hearing enough about this. The fact that there are not enough CNAs going into these positions. Maybe we should think about other areas. And I actually had a conversation with legislators after that about other bills that we could put forward to advance some of those issues. So eventually, nurse staff ratios passed. And we've seen other bills advance that are supporting the workforce. So that's a big area that I work on. So
yeah, thank you. I continue to struggle with that CNA, yes, to this day, or though that was a long time ago. So, but thank you. Great example.
And so I testified twice on S-173, and that is the bill, the religious exemption bill for inundated child vaccines. So the first time I testified was in 2018, and I was part of a group. I was not on myself. So I was part of the State Nurses Association, and I testified with our current and the executive director at the time, our president, and our legislative team. So there were five, the two chairs of the legislative team. So there were five of us testifying. And it was an experience like no other. Let me say, it was very contentious. It was, I didn't know what to expect. I was very nervous. I knew that I was very on board with testifying because of what I was seeing in my community, in my little town of Hillsdale. And then I also was very involved at the county level. So our immunization rates were dropping. So in 2018, I was nervous. I went, everything, we each of us spoke. We had about 2 minutes to speak. We had the process, right? You have to follow the process. And we got through it. And it really seemed like it was well received at the time. We really didn't have but wasn't a lot of public comment at the time. We left feeling like, okay, our position, is to maybe appreciate the position that we took. What we were trying to do was to clarify and codify religious exemptions in an effort to minimize inappropriate ones. Like there were a lot of philosophical exemptions, really, but they were, offered at New Jersey. So most people who were going for exemptions, the parents, were going for religious ones. So we were trying to kind of streamline that to really, kind of zone in on religious exemptions by clarifying it and by codifying it. So when we left the meeting after the first time I testified, we felt, okay, this was good. And everything was quiet for a year. We were just getting updates. We were collecting data, across the state. We're very grateful. I'm very thankful that we have the Standards and Practices Chair for the State School Nurses Association is also she works at the national level, and she is part of the data collection team of developing a data set for school nurses so that we can advocate for not just school nursing, but, different public health programs, community health, because school nursing is public health and is community health. So we kind of did that following year, which was 2019. At the end of 2019, we testified again. Well, it was like a completely different environment. So we testified for the same bill, 2173, and it was just terrible. I mean, we were attacked by the public. They were throwing things at us. It was so out of control, and they were calling us names, and they were directing it at the nurses, because there were other people who were supporting this, because there were parent advocacy groups that were opposed and for supporting this. So, but they really zeroed in on the nurses, saying that we should be ashamed of ourselves. We're pilly children. They start talking about, all the other issues that you would hear about, autism, just so many different issues. And we only had our 2 minutes, so each of us to speak. So we were speaking over people screaming, throwing things. When we walked out, our executive offered no, or they did, but no one was listening. And then the executive director on the way out was tripped and she fell. It was just, we done that to testify. Yes. No, but the thing is, and I don't need to do. Ireland is such a big believer, tell you. I have a totem before for testify. And it kind of continued even after the day that we testified, because I'm trying to tell the truth, right? So we were getting phone calls at home, we were getting emails at work, and it was harassment. So anyway, we did have it eventually died down. I reached out to our assemblyman to see if he could help, because I had established a little bit of a relationship with him, and to see what we could do, to further this whole cause. But the bottom line is it never passed. And I guess and I know that I can't imagine we have an environment now where that way passed. But yeah, I'm sorry, I didn't mean to say that to frighten anyone. I actually was very proud that we did it. And I really felt that, I don't know, I saw in my practice as a school nurse that immunization rates were dropping. We have a pertussis outbreak in my school, and then I live very close. I'm all the way up in northern New Jersey, only a mile from the state border, the Rockville County. We're very close to Rockville County, and they had the measles outbreak. So there were so many, just real life examples of how threatened this was, and I would do it again. I mean, I'm not sorry that we did it. Our voice was heard when we went back to our districts, and then we went back to, because we're all from different districts throughout the state. The nurses testified, and it was nice to be acknowledged. But that we did that work, and even though we weren't, it wasn't just us. I mean, so many people were testifying. We were just one small group, but I feel like our voice as school nurses. Our voices were heard, and a lot of practice nurses, practice nurses working at school nurses, and that they really helped amplify too. There is and I am very supportive of that. And actually, we're working with the State School Nurses Association to help to support that. So we're doing everything we can to support that. So, okay, the best.
Well, your example is really good because it does illustrate who is in the Assembly and the Senate. It's typically businessmen. We have one nurse, Nancy Munoz, but you are bringing to them real life examples of what's going on and why you want them to support that legislation. And I think that's what's really important. So now I just want to move on to talking more about testifying. And I think some of you mentioned about building relationships with your Senate or assemblyman. And I think that's really important. I've never testified, but I had a really good relationship with my senator. And he, I'll give you an example when we had that overdose, what was it? The Overdose Prevention Act. I met with him and I simply explained to him that Narcan for overdose patients is like AEDs for heart attack patients. And he was like, I get it. Okay. And then he would come to me. Once you have that relationship, they come to you to ask you questions. And I learned from him too. He would say, all right, I know you're for it, Sue. Who's against it and why? But I think framing our issue when we're testifying is really important. So maybe tell us about more detail about your experience testifying, how you frame the issue, and that sort of thing.
I'll start here. I feel when you are trying to get a bill across, I think you really have to look more, not the reason why. It's kind of like a hypothesis. You want to test it out and figure out what's happening. So I think when it comes to full practice authority in New Jersey, you have to really look at, what are the issues? And historically, this bill has been, right now it's S19838944. And historically, it was very contentious among physician versus nurse practitioner / APN. And when I came on board, I say it now and I'll say it then, I am not going to go against my physician colleagues. I will not put another person in my profession, because we all work as a team to provide access to care. Now what I've done with legislators, when I meet with them, physicians are great. They're experts in the field. There are not enough of them. There are 10 million New Jerseyans and there's X amount of providers. There's not enough of them. And JCC put out a great report on, districts, modalities. Not only just businessmen sit on these Senate and assemblies, but attorneys do. Lawyers are very fine tooth and comb in reading your bill. They look at everything, possible avenues. They have special counsels like the Democratic Tim Lyons, who's now with Mikey Sherrill on her team. He's the attorney, was the attorney advisor for Democrats. You want to make sure that you are able to pitch this to them to ensure safety. So you have to really make sure that your bill could be controversial. You definitely can have controversy in your bill, but what is the message and why does the other side oppose it? And you want to hear their points. There are concerns about safety. There are concerns about education, but not one study out there will tell someone how much time does one deem competent. There's not one study out there that will tell how many hours one needs in practicum to make them a competent provider. So when we look at that, we have to really look at the model of what we are as providers and what we're doing. So what I've done is I've shifted my focus in saying there's not enough of them. There's an access to care issue. These residents are not getting slots now because of what's happening in the federal level. There's a shortage. There's going to be more of a predicted shortage. There's more New Jerseyans coming into New Jersey. We want to make sure that we pitch that. And when I testified, the resident physicians were not very kind. They did say a little contentious stuff. And I said, you know what? My residents spoke from the heart. Again, my residents who had a holiday party, I covered them. One of them had, one of our ENT surgeons did a tracheostomy, and the residents packed it with like a bunch of gauze because the patient was bleeding instead of using like a clot stopper like Surgicel or something. And what happened was the patient developed a clot and that was obstructing the airway. It was not the correct dressing to use at that time, but I caught it and I spoke to an attending surgeon and I was able to do that without any collaboration, without any, and that's the key. You work together and you push that across. You don't make it contentious. And historically, this bill was very contentious. And there was a physician, you will find this very often, there was a physician who was chair of that committee. And if you kind of think about it, it's a conflict of interest, right? But you don't want to be contentious. You want to be politically correct. You want to know your homework, what their concerns are. Physicians are great. There's just not enough of them.
Thank you.
That's a great point. And so you made a great point. And somebody asked earlier about bills skipping committees. And I agree with Jean. That's the exception to the rule. It's very rare. But it brings up a good point that it's not just testifying here in Trenton. It's not just coming from committees. You can legislators and their staffs in their district offices and talk to them well before Phil ever sees a committee hearing. And often that's the time when amendments can be made. That's the time when legislators and their staff have an opportunity to learn from you about what the bill really means and what impact it might actually have. And they want to hear from you. They don't want to hear as much from me. So I'm going to be paid to do this. They want to hear from people who actually do this. So a lot of times I'm trying to bring physicians, nurses, people who are actually doing the work in front of these committee hearings to testify, because you can tell them exactly how this will impact your career, your future work, your patients. So I would say doing your homework for sure. That's a huge, huge thing. You definitely don't want to be untrue when you come in front of a legislator. You can definitely say, I've done this many times, I'm not sure, I'll get back to you. If you're not sure of an answer, that's completely acceptable. And as Jean mentioned earlier, you can say, I'll get back to you through the chair, and through the chairman, you will distribute information after the fact. And then just being genuine. I think that's really a huge part of coming here and getting respect and credibility, is being yourself. People want to see people who come here for the right reasons, who have passion about the issue that you're testifying about, and really just being exactly who you are, becoming a parent, not giving a canned speech. I would say that's really important. If you're nervous, people have a tendency to read what they've written. I would try not to do that as best you can. Legislators definitely do not want to hear an hour-long speech and give you 2 minutes. They will ring a bell. They will tell you to step up with aid. So just write a note card of a couple of bullet points and say, this is why I'm here. If you can give some anecdotes and some personal stories, that's even better. But just speak from heart. So that's perfectly there. Thank
you. And just another little nugget of information to give you about testifying. I do a lot of reading on certain bills, and when New Jersey passed the bill that nurses could pronounce in any setting, I read about that in other states. And one state said it didn't pass because a patient's family spoke about an adverse event. So to me, that illustrates the nurses need to be there explaining this legislation and the rationale for it. And sometimes it's those adverse events of one person that prevent that from being us. So testifying for all of us, we all had valid nursing experiences, is really important. So anyway, so take away the stage. Tell us that.
Okay. So to me, I think the best way if we can begin to frame it, I think building relationships, collaborations, right? To me, Diney's helped me so much in the work that I've done, which is not that nearly as extensive as my co-panelists. But I think that doing that, Cox to do is harder to say that, to become genuine, to really, get to know each other. So, I knew my case supplement from my congressional district, she'd call it. And then also in my work with the Nurses Association at state level, the State Nurses Association and the State School Nurses Association, we have very close relationships with two senators, Senator Ruiz and Senator Vocal. And they have been just wonderful supporters of us, but, they have educated us in the legislative process. They've kind of walked us through, we're a small association, but we're a passionate school. There's a lot of us throughout the state, so we have many members, and we are always looking for opportunities to advocate for our school communities and our towns. So I'd like to give an example of one that just happened. That we came to our attention through our legislative team that there was a bill that would propose LPNs could work as the sole school nurse in a school. And there would be a requirement to have one certified school nurse per district. So you had some districts where there's 50 schools, and then you have some that have 3 schools, right? So it's very different, and every district is unique. But really, it came down to when we found out about this bill, legislative team brought it to the executive board, and just with the wording of the bill, no one could testify yet. So it's in that phase, I guess, that you mentioned, where you actually testify. And so we were very early on in the process. We heard about this. So we reached out to Senator Coppola immediately. And we had a meeting with him. He said, well, you have to tell me why this is not. So we talked about scope of practice. We looped in the board of nursing. We were able to, it's hard to reach the, executive director of the board of nursing, but we kept at it, and then also having Senator Bocal's name on this, email reach her definitely helped. So that goes to like the history that with like we had a relationship, an ongoing relationship with him. And Senator Ruiz heard what we were doing. She also supported us. So this was actually, I don't know what you would call it, but it was basically because the whole bill collapsed. Hill would sign it, right? He killed it. So I think that was an example of something, where I don't know if with Marcellus is, but where if you act quickly, sometimes I guess you can be rocky and the ahead of the process before people start testifying. So it was killed before it even got to that point. And that was huge for us, right? Not just for school nurses, but for nurses throughout New Jersey, right? We want to protect our practice and we want to, of course, ensure public safety. And the Board of Nursing, as soon as they called it, they were very supportive of us. But I do think that having had a senator really helped us tremendously. She would have listened to us as nurses, but we were able to see her quickly because we had, a legislator, involved.
Another great saying. Thank you very much. And illustrates the importance of relationships with the Senate, with senators and assemblymen, but also joining your professional organizations. That is so important. So do we have time for student questions of our panel? How are we doing time-wise?
We're not doing too well. I mean, there's not too much time left, and I know you have a hard stop, Marcel, but I thought maybe we can have students come up here. Are these mics work?
Yep, they just have to press the button.
Okay. Does anybody in the audience want to come up and ask a question? Here? You can practice like pushing the button, turning the mic on, just like a legislative session. You can sit down if you want, whatever you want.
All right. I just have one question. Are there any issues that you're actively advocating for now? That's yeah.
Is that to me?
That could be
To anyone. Yes.
Yes. So I'm actually advocating for full practice authority. We have it's bipartisan support. We have over
40. So in order to pass a bill, which you let me be, that is 80 assembly members, over 40%, 40, which is over 50%, 41, which is over 50% have to support the bill. And then the Senate, 21, which is over 50% have to support the bill. And right now we have those numbers in both the Assembly and the Senate. We worked really hard. We also now have American Academy of Nurse Practitioners. It's not a local organization. It's a national one that actually got involved because they saw our traction and they're helping us and they've dedicated financial support to give us a lobbyist in addition to NJSNA that has a lobbyist and now our society has a lobbyist. And I know the Hospital Association also is really much in support of our bill. So there's a lot of advocacy going on. We have a few individuals who are in power who have concerns of the bill because of the physician community. But again, you basically speak from the heart, you say what you want to say, and then you get it across. And hopefully during our lame duck session, which is what we're making on, we're going to hopefully get this bill after all these years.
one last question. How can we, as new nurses, once we graduate, can we start to get it going, the state of policy advocacy? Like somebody said it before, getting involved in your professional associations is super important because they have a lot of resources dedicated to tracking bills every day. And there are thousands of bills that get introduced every year. Many of them never make it across the finish line or even close. But there's a lot of ideas out there. So knowing about all the ideas and filtering down into the ones that are actually important, the ones that will actually get done, that's really the role of a professional association. You can certainly do some digging on your own as well. The New Jersey legislature has their own website. That's where all of the testimony is, sort of repository of all the live testimony. You can actually listen to it live as well. You can look at the schedule of committee hearings. So I think Shane said earlier, there's going to be a whole cadre of committee hearings after the election. So typically the legislature won't come back until after a major election. So after November 4th, they will come back. There will be a whole schedule of committee hearings. I would say if this is something you're interested in or think you might be interested in, check out those schedules. See when the committee hearings are happening. Typically for nurses, you're going to be most interested in the health committees, the human services committees, and the regulated profession committee, because that's really going to be where all the nursing bills go. So I would check out a committee hearing. You can come here in person and see what it's all about. You can meet people here, and you can also listen to it live on the New Jersey Legislature website. So I think there's a whole host of ways to get involved, but I would say you can do anything from being passive and listening and learning to being more active. And when you get involved in a professional society, they might ask you to come and testify. They might say, "Do you want to participate, Phil? And would you be available?" Here, if you have a passion for this, say yes. Just say yes. Come and do it. If you do it once, you'll do it again, and then you'll get practice, and you'll feel like you're really contributing and making a difference. So there's a ton of ways to get involved, but just say yes.
Thank you. I'd like to add, can I try to that? I think as a nurse, especially you said you're starting for your own, some of you may have been nurses and then you're going back to in graduate school. But I really personally think that joining the State Nurses Association is an excellent way to get started. They have a legislative team. They have, because it's the state, there's meetings all over the state. There's dinners. It's great networking opportunities for you to meet the president in your region. I think that it's just a great way to kind of just get your feet wet. And if you are interested in a legislative piece, they're at the meetings they always discuss legislation. Always. I mean, I've never been in a meeting.
Yeah, I'd agree 100%. That's how I became this legislative junkie. That it was through New Jersey State Nurses Association and involvement in Congress on policy and practice. And people think you're experts in the bills, but sadly, it's because the bills are around for a long time. They don't pass. I wish they would, but like protect the title nurse, that's been around, the full practice authority. So you get to know the bills really well, and it's fun. But the other thing I'll say is on our New Jersey Collaborating Center website, we have the current bills that would be of interest to nurses under the policy tab. So you can look there for more information.
Thank you so much.
Can I just add real quick? I think everyone in the room needs to get involved. I think this is something that you should get involved in related to your profession. There's only one nurse in the whole legislative process in New Jersey. If you look at Pennsylvania, they have about 4 or 5. And there's some of the nurse practitioners, some are nurses. You need to advocate for your profession. If the nursing community comes together and you take the numbers of how many nurses there are in the state, and I'm talking about from RN, Associate, BSN, MSN, quarter mil, a lot. And you have a lot of power. And that's how what they call organized medicine. We can have organized nursing. And we need to move in that direction to get some of the bills passed because they don't get heard. There's not a lot of voices because people who are advocating for these bills are not in the trenches, but you all will be. And that's what you have to speak to. There was a nursing scribe bill that was put out and that was killed, quote unquote killed. What is a nursing scribe? What do we need this for? The fields with AI. So you have to really advocate for the right thing for your profession. And I think everyone needs to get involved. And I agree, joining the State Nursing Association, various organizations nationally, get involved. Don't just, why is this going on? Why does this happen? Laws and regulation dictate your practice in your hospitals, in your clinics, etc. So please get involved.
Thank you.
All right. Well, thank you very much to our panelists and to the audience and our listeners. I just hope you leave today inspired and wanting to get more involved with advocacy.
Isn't it a test better Russian? Yes. And then after that, I think your tour is here, right? Yes.
Oh, I'd not be able to advocate that. That's fine.
Do you want Sue to repeat that question just so they can splice it in? Can you repeat the question that was just asked about how new nurses can get involved with state policy? If you could just say that, Sue. That was your question? Oh, that's what they just answered.
Not on it. That was one of the 2 questions.
Okay. Can you say that question again and we'll splice your question in front of the answers?
So college nursing experience do you think is appropriate to have before you start testing about?
No worries. I don't think it's just nursing experience.
That's my answer. I think it's everything that you bring to it. If you're a mom, you have kids, and there's problems like vaccines, bring that to the table. If you come from another state and you have practice issues, for example, nurse practitioners, we are categories in yellow for signing death certificates. If you look at the bill, sure, nurse practitioner can sign a death certificate. However, only when the physician nor the resident is not around, right? So here's a potential scenario. The doctor went to McDonald's and technically he's around. He's just on break and you signed a death certificate. Where is that? How is that law going to protect you? Which is something that we're advocating for. We constantly advocate for adding the language of nurse practitioner, and mine a lot of these also work with the PA community to any bill that's introduced. The loan repayment, they state physicians, not nurse practitioners, for mental health providers provide access to care in homeless shelters. The APN language was not included here. We asked that to be amended in the bill. You have to look at the bills and you have to be on top of them. But your experience, not just as a nurse, but as a human being, and providing that knowledge that you come with can do a lot of good for the community.
I would say as a student too. I think student experience, and you're, part of our state's university, coming and testifying about your experience as a student and what it means to want to be a nursing student, to want to pursue a nursing career. That's huge in terms of our workforce. We need to have a pipeline of nurses that want to work in this profession for their entire life. So your experience as a student is very valuable as well.
And just using that bill about protect the title nurse, that only an RN, APN, and LPN can use that if that bill ever passes. And you as a student can be, I've worked hard going to school. I feel like those who don't have those titles shouldn't be calling themselves nurses. So, I think that hopefully is a good example. Do we answer your question?
Could I just add one more quickly? It's kind of tacking on with what Tyler said. Take advantage of every opportunity that you have now while you're a student. I Rutgers alum. I went to the Hill today when that was off. When there are different, opportunities available to you, take advantage of them, because it's hard once you start your career to maybe take the time off, right? But aside from the time, it just gives you that experience. And then also the professors are just tremendous mentors. I didn't even mention how much they inspired me. When I was in my graduate program at Rutgers, I just admired them and looked up to them. And that's why I went ahead and participated in the different, activities that were offered to us. So really get involved in the life of the university. It's a great university, huge, right? It's the flagship university. And I think, you'll all be very proud Rutgers graduates like I am one day.
All right. Well, thank you. We hope we demystified the process of testifying for everyone and that you'll consider testifying. Thanks for listening, everyone. I'm Sue Weaver, and we'll see you next time on the regular episode of the Nursing Insights podcast.